Family Medicine Cares is what we call a signature program. It's our attempt to really focus the energy of the foundation on areas of very high priority. And the domestic signature program is to help create a network of free clinics around the United States.
There's still domestic needs here at home. There are things we can do right here to make lives better for our neighbors, our friends, the people in our communities.
And it brings together all the different state chapters and different areas within the family medicine family so that they can get involved in a humanitarian outreach.
We have an excellent free clinic in Spokane, but with the economic challenges facing our community, there certainly could always be more.
Well, the Academy's foundation has had more than 24 programs, both within and outside the United States, but every family doctor knows that there's a desperate need today. Many people are without insurance, and so we'd like to help family doctors help their communities by providing these free clinics.
They can find the volunteers, but it is hard for them to get the resources to have in place the tools necessary for those volunteer healthcare providers to do the job that they do, taking care of uninsured patients.
Our foundation is able to provide the startup money to communities that want to start a free clinic and give them that critical amount of funding that helps them get over the hump and get started. I hope we someday get to where we have a healthcare system that takes care of everybody and there isn't a need for free clinics. But in the meantime, we definitely are going to need these to meet the care needs of people who don't have healthcare coverage.
Most of us went to medical school saying that we wanted to help people. And we think that we do that every day in our practices, and we take care of our patients. But we can go above and beyond that. It takes so very little from any one physician to donate to the foundation, but together as a collective group, through our foundation, we can have a huge impact on communities. We can start clinics where there weren't clinics there before. We can cover new populations with health care that we all know that they need, simply by taking the time to make a donation.
When you're helping somebody who can't get that help elsewhere, you end up finding that you help yourself and you get back to what you really got into medicine in the first place. And if you're working in a clinic where most of your patients are insured, there's a patient population out there that you're not interacting with, and I find that patient population very appreciative, and they help remind me what I got into medicine to in the first place.
I have no doubt I've made the right choice for me.
It's hard to do this on your own. It always works better when you can work with the others in your community, and a free clinic is a place you can bring all of that energy and goodwill together.